Every winter, Delhi wakes up to a grey blanket, a toxic fog that doesn't just dim the sunrise but cuts life expectancy, triggers asthma, damages hearts and lungs, and turns every breath into a gamble. The science is unforgiving. PM 2.5, microscopic particles so small they pass deep into the lungs and bloodstream, routinely exceed safe limits by many times, even in a comparatively better year. Late 2025, Delhi's average PM 2.5 levels were nearly 2.5 times higher than India's own air quality standards, and almost 20 times higher than what the World Health Organization considers safe. At its worst, Delhi's air quality index has crossed 400 to 500, levels scientists classify as severe to hazardous. Schools shut down or restrict outdoor activity. Health advisories flood newsrooms. Citizens wear masks indoor, not out of fear but necessity. This is not an occasional environmental issue. This is a chronic public health crisis. A decade ago, Beijing lived the same nightmare. In 2013, the city was synonymous with air apocalypse. PM 2.5 levels regularly crossed 500. Visibility dropped to a few meters. Flights were cancelled. Citizens protested. Doctors warned that prolonged exposure would shorten lives. Today, the contrast is impossible to ignore. Beijing is visibly clearer most days than it was 10 years ago. This shift did not happen naturally, but it was a result of a decade-long national effort backed by massive public investment, strong central accountability, and strict enforcement. Cities across China, including Beijing, have recorded hundreds of days with significantly improved air quality compared to the past. And yet, even Beijing still sees occasional smog, spikes AQI between and up to 200. A reminder that clear air is fragile and must be protected, continuously, not seasonally. Two cities, one shared past, two different trajectories. The health crisis we have normalized. In India, air pollution is linked to over 1.6 million premature deaths every year. Long-term studies show that residents of Delhi may lose 8 to 10 years of life expectancy due to sustained exposure to polluted air. Hospitals report rising childhood asthma, chronic obstructive pulmonary disease (COPD), pollution-triggered heart attacks and strokes, reduced lung development in children, long-term lung damage even among non-smokers. Children growing up in Delhi today often have lower lung capacity than children in cleaner cities. Elderly citizens avoid outdoor activity. Pregnant women are advised to stay indoors for weeks. This is not fear-mongering. This is measured, documented harm. And yet, every year, the crisis returns, and so does our surprise. Why Delhi still struggles to breathe? Delhi's pollution is not mysterious. It's the result of known repeated causes. Crop residue burning in neighboring states, coal-based power generation, industrial emissions, construction dust and weak enforcement, old diesel vehicles and congested transport, open waste burning and poor urban planning. These sources have been identified for years. Reports have been written, committees have met and been formed. Pollution is treated as a winter inconvenience, not a year-round public health emergency. Government, corporates and public, a shared failure. Government. Accountability is diffused across institutions and states. Clean air plans exist, but enforcement is inconsistent. Action accelerates only when global rankings or headlines become embarrassing. Corporates. Many industries comply on paper, delay real upgrades, or absorb penalties as operational costs. Environmental responsibility is often confined to reports, not embedded in business decisions. Public. Citizens adapt masks, air purifiers, and closed windows become survival tools. Smog is normalized. Outrage fades into resignation. This is the moment where CSR and civil society must step forward, not symbolically, but structurally. Why CSR is crucial and not optional? Air pollution cannot be solved by government action alone, and awareness without infrastructure changes nothing. CSR sits at the intersection of policy, industry, and community, exactly where this crisis must be addressed. First, from token activities to system change, CSR must move beyond one-day drives and symbolic gestures. Its real power lies in funding clean technology, adoption for MSMEs, supporting non-polluting supply chains, investing in permanent air quality solutions, not seasonal responses. 2. Treating air pollution as a health emergency. CSR can strengthen public health by supporting school and community air filtration systems, respiratory health screening in high risk zones, research linking pollution exposure to disease outcomes. Cleaner air reduces healthcare costs and saves lives. 3. Empowering civil society organizations. Civil society organizations translate policy into action on the ground. With sustained CSR support, they can work with farmers on alternatives to stubble burning, enable community led waste and dust management systems, monitor air quality independently, hold institutions accountable beyond election cycles. 4. Holding corporates accountable to themselves. True CSR begins internally. No company can credibly fund clean air while polluting through its own operations or supply chains. CSR must align with core business practices, not compensate for them. What Beijing's story really teaches us. Beijing did not succeed because of a single technology or policy. It succeeded because clean air became non negotiable and a priority. Officials were held accountable, polluters faced consequences, investments were long term, health was prioritized over convenience. The lesson is simple but uncomfortable. Severe air pollution is not inevitable, it is the result of delayed decisions. The sky is still choosing. Delhi's story is still being written. Clean air is not an environmental luxury, it's a basic infrastructure for a healthy economy's productive workforce and a dignified life. If Beijing could reclaim its sky within a decade, Delhi can too. When governments act with urgency, corporates commit beyond compliance, civil society leads on the ground, and CSR stops being symbolic and starts being structural. Because the air we breathe should never be the reason we fall sick.